Tonight, we look at what could be a coronavirus testing breakthrough. The University of Illinois conducts up to 20,000 tests a day. That's 2% of all COVID tests done nationwide. Students are tested at least twice a week, with results coming in as fast as 5 hours. In our series, Racing to a Cure, we show you how some experts think mass rapid testing could crush the pandemic.
Do you have any questions?
The ambitious, innovative approach is happening here on campus and was designed by Professor Martin Burke and his team. They developed the saliva test, which they call iCovid.
You've done some modeling about what would happen if you didn't have this mass testing. What did you find?
What they predicted, if we brought all of our students back and don't do anything, is pretty much all of them were going to get COVID. I mean, it was a pretty humbling prediction as to how things were going to go. So we knew we were going to have to be, very aggressive.
So you created a unique test?
We had to. So they say necessity is the driver of innovation. And so we decided to go all in on developing a saliva-based test that could be fast and scalable.
You're up.
The university is a model for what some say we should be doing as a country: frequent mass testing, ideally at home. Harvard epidemiologist Michael Minna says widespread use of home tests could help contain outbreaks at the source and crush them in as little as a month.
The accuracy of them to detect people who are most likely to transmit to other people can get very, very high, probably in the high 90 percentiles.
There are currently no FDA-approved home coronavirus tests, but more than 24 companies are racing to develop one, including OraSure Technologies, which is the only company with an approved at-home test for an infectious disease.
An individual can get the results in the comfort of their own home in about 20 or 40 minutes. It will be done with a nasal swab, and it's read very much like a pregnancy test.
OraSure CEO Dr. Stephen Tang admits there are challenges in getting these tests to market, but is hopeful that his company is close.
We are on a regulatory pathway to seek emergency use authorization for product launch in the fourth quarter of this year, so before the end of 2020.
So that's coming soon. And while there is some concern about the accuracy of home tests, there's agreement among experts that America needs to be testing much more. Now, at this point, the U.S. is doing about 25 million tests a month, but one estimate says we need to increase that to 200 million. And that's why everyone is waiting for this technology to catch up.